All right, Daniel, thank you so much. Well, from the capital city to the nation's capital, Dr. Macie Smith was invited to the White House to talk about the challenges of being a caregiver for a sick or aging loved one.
Now, the program was part of Care Workers Recognition Month, which highlights the growing challenges for caregivers. And joining us this morning to help raise awareness about this topic, Dr. Macie Smith. I mean, you are a girl boss, okay?
Wow.
Speaker, author, educator, doctor. What do you not do?
I don't know yet. Hadn't figured it out.
I love that.
We have to talk about your visit to the White House. How was it? How did it kind of all get started?
Okay, so I've always been involved in public policy on a national level, but the one of the assistants to the president actually saw my videos on Instagram.
Wow.
And she reached out to me on Instagram, so that's why you got to be careful what you're putting out there, right? And so we scheduled a call because she wanted to learn more about my platform, what it is that I do, and how I align with the Care Workers Recognition Month. And of course, I gave her a lot of information. The next week, I was at the White House speaking.
That's absolutely incredible.
Within a week.
Yes.
Had to make some moves.
Yeah, but you've been doing this work for so long, been such an advocate, and what I want to do real quick is pull up some numbers, my friends, really help put this in context. So according to AARP, 1 in 5 Americans have provided care in the past year. 61% of caregivers are in the workforce, and then we also have learned that 22% of caregivers report that it's difficult to maintain their own health because of caregiving. Again, this is coming from the AARP. So, Dr. Smith, can you talk to us about some of the challenges that caregivers face?
So those numbers represent those in the sandwich generation. So those individuals who are caring for an older adult loved one or loved one with a disability, but they also have their own children that they're trying to take care of and working. And so one of the biggest challenges is being able to pay for long-term care, long-term services and support. So someone coming into the home to provide non-medical care to your loved one, the bathing, the dressing, the ambulation, the transportation. And so what's happening is I talk about the gap generation caregiver. And so that's where they're taking care of a loved one who makes too much money to qualify for Medicaid. Medicaid does pay for that, but don't have enough money to pay $25, $35, $40 an hour for someone to provide care. So what the caregiver is doing, the family member, they're either taking off time from work, working less hours, depleting their savings account to provide care for their older adult loved one who doesn't have enough money to pay because they're paying for insurance, they're paying for medications and food. And so what happens is that brings about stressors. And so a lot of those caregivers are stressed. They develop hypertension, they develop diabetes, they develop chronic illnesses that put them at higher risk of needing care themselves.
So is there anything that the community can do to help these caregivers?
Well, number one is to see them. Identify who they are, and don't ask if they need help. Let them know that you're going to help them. I often tell people sometimes it just takes a smile, a note to say, I see you, I feel you, I care about you, you're doing a wonderful job. Lend a helping hand. I also tell folks to get involved in public policy. A lot of times the elected officials don't know what's happening on the grounds because maybe they haven't experienced that. And so even though we don't have a union or anything here in South Carolina, we have associations. We have the National Association of Social Workers. We have the Home Care Association. So get involved, share your stories. Any opportunity to go to the State House on the local level to share what your experiences are, they need to hear that in order to develop policy.
Wow. Now, Dr. Smith, can you talk about some of the resources that are available to caregivers?
So I oftentimes tell caregivers and those living with a disability or a dementia is to enlist the help of an elder attorney. The reason I say a certified elder attorney because they're going to help them preserve their assets, to be able to find or figure out finances to pay for long-term services and supports until we make changes on the national level, whereas it could be paid. Also, you want to get involved in support groups. Lisa's Care Connection is here, offers free support for family caregivers. If the person is living with Alzheimer's disease, the Alzheimer's Association, the Department on Aging, give them a call. Your area agency on aging, give them a call. Just say, I need help, and that's where you start. Or you can always call me, Dr. Macie.
Yes!
Just go ahead right there.
Yeah,
We actually have all that information right there on your screen right now. It is your website. And of course, we're going to be putting this on our website, WLTX.com, so anybody can refer back to this.
Thank you.
Dr. Smith, thank you so much for joining us this morning. We appreciate you.
Thank you so much.
All right, everyone, don't go anywhere. We have more of your top headlines when we come back. Stay with us.